The CDC says the BA.2 variant now makes up 35% of new cases in the U.S., and that number is 50% in the Northeast. President Biden's chief medical advisor, Dr. Anthony Fauci, says he expects the U.S. to experience a rise in cases, but he stopped short of saying it will be a surge. The new variant is about 30% more contagious than Omicron, but medical experts say it appears vaccines are just as effective against both strains. According to health professionals, around 30% of the positive COVID-19 cases in the Midwest are the BA.2 variant. However, hospitalizations remain at all-time lows. WRTV's Meredith Hackler sat down with a doctor from Franciscan Health to find out if this variant could cause a surge here in Indiana.
Joining me now is Dr. Christopher Doehring, the Vice President of Medical Affairs at Franciscan Health, Central Indiana. Thank you so much for joining me today.
Absolutely. Good to be with you, Meredith.
Obviously, COVID cases have decreased quite a bit, but where are you guys at when it comes to your hospital census, specifically when it comes to COVID-19 cases?
Yeah, our COVID census has dropped precipitously. We really have very few COVID patients in the hospital right now. A number of the ones we do have are still more of the critically ill ones that are been on ECMO for several weeks, even a couple months. But as far as active current COVID patients, a very, very small number, some days, down in the low single digits.
And a big topic of conversation right now is the BA.2 Omicron variant. We've seen it kind of pop up in other parts of the world and in other parts of the country. Are we seeing that here in Indiana and specifically in the central Indiana area at this time?
Yeah, not really. The Omicron surge did actually have a subvariant component to it, and so the good news is what it looks like with the BA.2 or the subvariant of Omicron. We do seem to experience good protection from having either had Omicron or having been vaccinated. So right now we're not seeing much activity at all with COVID, period, let alone the BA.2 subvariant at this time.
Are we in an endemic yet?
Yeah, I think that's going to be another question, because part of that is related to just ongoing spread of existing strains, but then there's also the question about future emerging strains. And so my guess is that COVID-19 or this pandemic we've come out of will be with us for probably years to come. Hopefully more of a seasonal, relatively mild disease, especially with vaccination and prior natural protection, but still remain to be seen if this is more of a variant surge, unpredictable sort of rhythm, or whether this will become more of a seasonal thing like influenza.
All right, Dr. Christopher Doehring with Franciscan Health, thank you so much for joining us.
Absolutely, Meredith. Good to be with you.
Well, Dr. Doehring also says that as long as hospitalizations remain low, masks can remain off.
Right now, hospitalizations are the lowest we've seen in nearly 2 years. This graph from the State Department of Health shows hospitalizations of COVID and suspected COVID patients from April 8th, 2020. Yesterday's number of 360 is the lowest in that entire time span. The overall spread of the virus also continues to show marked improvement in Indiana. The map released today shows just 5 counties in yellow, the second lowest level of spread. The rest of the state is all blue. And when you look at the past 3 weeks, it just keeps getting better as red and orange are erased from the map. Those are the 2 highest levels. Specifically, the state is reporting 288 new cases today, but some of those go back to November. The 7-day positivity rate is holding steady at 2.2% for the 3rd day in a row. 22 more Hoosiers have died with COVID-19 between February 4th and yesterday.